Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be I can't speak. We're going to be covering mental health medication. So this is pharmacology, but it is also psych mental health. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're gonna love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you have done so already. And be sure to check out my website, nexusnursinginstitute.com. I've got lots of great resources there for you. Again, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Pharmacology for mental health. First question. You're about to administer sertraline. How would you give it safely? Would you give it on an empty stomach? Would you give it at the same time each evening? Would you give it spaced evenly around the clock? Or would you give it PRN when the patient reports feeling depressed? How should this medication be administered safely? Very good. At the same time each evening. So this medication, guys, it's given every 24 hours, right? So you're going to give it at the same time each evening. So it's going to be once a day, same time. This is an antidepressant. And you need to know the drug class. So yes, it's an antidepressant, but you also need to know that it is an SSRI. And something important to know about the SSRIs, they are the very first drug class you expect to be ordered as an antidepressant because it's the most effective with the least amount of adverse effects. You need to know what drugs fall under that drug class, okay? Which labs would you monitor for schizophrenic patient on clozapine? Would it be platelets, glucose levels, level liver function tests, or WBCs? We're talking about clozapine. What are you going to be checking for? I see you guys on there you go. Very good. Mm-hmm. Okay, so let's talk about it. Okay, I know why 70 of you guys went with liver function test. So let me address the correct answer first, and we'll go to the liver function test. The correct answer is WBC. So let's talk about it. First of all, you need to know what drug class this medication falls under. So you need to know that it's an atypical antipsychotic agent. And a very important and lethal adverse effect that you need to know about this drug is that it can cause agranulocytosis. So you're going to be checking the WBCs very closely. And I'm telling you right now, those WBC is supposed to be 5 to 10,000. Once it drops to 3,000, the healthcare provider is going to take the patient off of this drug because we're not taking any chances, okay? Agranulocytosis is potentially deadly, and that's something you have to watch out for. Now, with that being said, 70 of you guys went with liver function tests, and I know why. Because for every drug, you're always going to want to, you're always concerned about the liver because the liver is what's responsible for metabolizing these drugs. I get it. But if you get a question that's asking you about a specific drug and they ask you what you are going to monitor for. If you have no idea what the answer is, okay, take your chance going with liver function because you'd be guessing anyhow. But even if you had an inkling, you were even thinking WBC, go with WBC. Why? Because liver, you're checking liver for everything under the sun because the liver is what metabolizes these drugs. But if they're talking about a specific med, usually there's something going on with that specific med that they're asking about. And, liver is for everything and kidney functions for everything because just like the liver is responsible for metabolizing the drug, guess what? The kidney's responsible for excreting that drug. So if they're asking about specific med, usually they're looking for something very specific. And in this case, it's the WBCs. We're concerned about agranulocytosis. All right. How are you guys doing on the live? Okay, let's keep going. Your patient is prescribed phenobarbital long term. Which teaching would be a priority? Avoiding alcohol use, taking this drug with meals, taking this drug at the same time each day, or using a pill box to help prevent missed doses. You guys are doing great on the live. Good job. That's right, Abby, thanks. So the correct answer, very good. Avoid alcohol use. So phenobarbital, guys, this is used as an anticonvulsant agent, but it's also used as a hypnotic agent. Why? It causes CNS depression. As much as people think alcohol is a stimulant because in the movies people are drinking alcohol and they're going crazy and they're hyper. No, alcohol is a CNS depressant. Right? So if someone is taking phenobarbital, which I just told you is a CNS depressant, again, it's an anticonvulsant, but also used as a hypnotic agent. Why in the world would you be taking another CNS depressant such as alcohol? That's number one. And number two, you can't take alcohol with any meds across the board. That is the most important teaching that you would be providing for this patient because guess what? Taking those two CNS depressants together can have lethal consequences. Okay. All right. Your patient's being discharged home with an order for Oxazepam. Which patient teaching would you incorporate? Would it be consume a low fiber diet? Would it be increase fluids in bulk? Would it be rest if you begin to experience tachycardia or take an antidiarrheal if you experience frequently liquid stools? Okay. Most of you guys got the correct answer. So this drug, you have to know what drug class it is. It's a benzodiazepine. It treats anxiety and alcohol withdrawal. Now, and it can treat short-term insomnia. Short-term because this drug can be very addictive. It also can cause constipation. So you're going to teach the patient to drink lots of fluids, um, ingest lots of fiber, and to ambulate a lot, right? To help to decrease the constipation. Now, let's say you had no idea what the answer was. If you looked at your options, you would have saw two opposites. You see, consume a low fiber diet and then increase fluids and bulk. Right? So you should have said to yourself, okay, I have no idea what the answer is, but these two are kind of the opposite. Let me take my chance and choose one of those. So that's kind of a trick that you can use when you don't know what the answer is. But you do need to know that for benzos, constipation is a big deal. You're going to teach the patient about fluids, fiber, and ambulation. All right, your patient has a new order of risperidone. What are you going to include in your teaching before you give the patient that medication? Here are your options. Get plenty of sunlight and vitamin D. Continue driving as usual. Avoid foods high in potassium, or get up slowly when changing position. What are you going to teach your patient that has been prescribed risperidone? What do you guys think? Very good. Get up slowly when changing positions. You need to know this drug. You need to know that it is an antipsychotic medication. Um, it can cause orthostatic hypotension. So you're going to be concerned about that. You're going to teach the patient if you have to get up to use the restroom, press the call button so I can come help you get up. You're going to make sure that bed's in the lowest position. You're going to make sure there's these safety measures in place. You're going to teach the patient to make sure they get up slowly when they change the position because we are concerned about orthostatic hypotension. We're concerned about safety. The first option, get plenty of sunlight and vitamin D. Risperidone can cause photosensitivity, so that's not the answer. Continue driving as usual. Let me tell you something. When it comes to antipsychotic medications across the board, we don't know how your body's going to react to it when this medication is new. So we're going to be very cautious with you driving or operating any type of heavy machinery. And then avoid foods high in potassium. There is no contraindication with foods, electrolytes, and this type of antipsychotic drug. Okay. All right. Type in your answer. Your patient is prescribed excuse me. What diagnosis would you expect to see in their chart for this medication? Type in your answer. When it comes to this drug, phenelzine, what diagnosis do you think the patient has? Type in your answer, guys. This is a fill in the blank. You guys are getting real quiet on the live. Bipolar, UTI, infection, psychosis, schizophrenia. Okay, guys. So the two that are accepted is depression, which really that's what this drug is for. This medication is an antidepressant agent. It's an MAOI. However, it sometimes is used as an anti-anxiety medication for like people who have like social anxiety or panic disorder. However, that is an off-label use. You need to know that. Why should an off-label use be important to you, the nurse? Here's why. If the healthcare provider orders a drug that is off-label for diagnosis, and you administer that drug, you gave that drug, it was ordered, you gave that drug, and that patient has some type of reaction and they sue, that healthcare provider is going to be in trouble, but so are you. Why? The FDA did not approve that drug to be administered for that off-label use, the diagnosis. So be very careful, right? This patient, the doctor ordered this MAOI, but there's no diagnosis of depression. That healthcare provider is ordering it because that patient has social anxiety. Let me tell you what I would do as a nurse. I would call that healthcare provider up and tell them to give that drug themselves. I'm not taking the chance, but that's just me. I don't play those type of games. But I'm just letting you know when a drug is given as off-label use, you need to know what that means and you need to know the consequences of it for you, the nurse, okay? All right. Figs are an accept Figs are acceptable to consume when the patient's on phenelzine. Is this true or false? Figs are acceptable to consume when they're on this drug, phenelzine. By the way, guys, look at this fruit. Look at this fruit. I was today years old when I found out that figs, this fruit is figs. I always thought figs were bananas. I never knew that this fruit was figs. When I was making this Kahoot for you and I was looking for a photo, this photos of that thing just kept popping up. And I'm like, what is going on? So I go to Google, I type in figs and I click images, and that same fruit I'm looking up kept popping up. I did not see a banana in sight. Now I'm Haitian and figs in Creole is, is banana. And I always assumed in English figs meant banana and banana meant banana. I never dreamt that fig was something else. I couldn't believe it. Why would anyone want to eat a fig? I never knew that that fruit thing is a fig. Oh my God. And guys, you know how many times I've taken the past boards? I've never failed boards once thinking the fig was a banana. Mm. Those that are watching from YouTube, I'm going to be taking boards again, but that's a long story. Go to my TikTok and I'll tell you all about it. Anyway, let's get back to this. Figs are acceptable to consume on phenazine. False. That is false, guys. You need to know again, this drug phenazine, it is an MAOI. It treats depression. And there are lots of foods that cannot be ingested when you're taking an MAOI. Figs are one of them. Fruits such as avocados, raisins, figs, you can't have it. They're high in tyramine. Thank goodness I never got a question that said bananas instead because I would have chose it. I thought they were the same thing. Okay, so no, no figs, no avocados, no raisins, none of those. True or false? Yogurt is acceptable to consume on phenazine. Is this true or is this false? That's right, Lauren. Did you guys on the live know that that thing was a fig? That picture that was up? Did you guys know that? Okay, false. No, yogurt is not acceptable, guys. No yogurt, no aged cheese, no red wine, no, anything that belongs on the charcuterie board. If you go to the deli department, anything in the deli department, anything that has been preserved, it's going to be high in tyramine. So that's a no-no. Smoked meat, correct. All of those are no-nos. Your patient on antipsychotics starts smacking their lips, protruding their tongue, and grimacing. What do you suspect is happening here? Do you suspect Parkinsonism, tardive dyskinesia, hypertensive crisis, or neuroleptic malignant syndrome? What do you suspect? Very good. Tardive dyskinesia. So, tardive dyskinesia, when patients on antipsychotics, an adverse effect that can possibly happen is that the patient will have these abnormal body movements that they just can't control. They'll have these abnormal movements of their extremities, especially the tongue, and they can't control it. That is tardive dyskinesia. Parkinsonism, we see this when the patient has a decreased level of dopamine. They don't have enough dopamine, and the patient will have TRAP symptoms, TRAP, T, tremors, arrest, R, rigidity, muscle rigidity, A, akinesia, P, postural instability. So that causes them to be at risk for falls. Hypertensive crisis. We were just talking about MAOIs and we were talking about foods high in tyramine. If you're on MAOIs, you need to stay away from foods high in tyramine. And the reason why you cannot have foods high in tyramine if you're on an MAOI is because we're concerned about hypertensive crisis. That's what can happen to the patient. The patient will have, they may experience headache, they may experience neck stiffness, nausea, and vomiting. Of course, their blood pressure will be through the roof. And last, a neuroleptic malignant syndrome. This we can see patient can get this where they can have like fever, loss of bladder function, um, muscle rigidity. No, correct. It's not reversible. The tardive dyskinesia, once the patient gets that, unfortunately, they got it. It's not reversible. Correct. What was I talking about? Oh, yeah, neuroleptic malignant syndrome, sweating. Make sure that you guys know the signs and symptoms of each of these, and you guys know these disorders, okay? Or these clinical manifestations. Okay, you check the labs of your patient that's on lithium, and the results show a lithium level of 2.7. What would be your interpretation of this? Is it normal? Is it subtherapeutic? Is it toxic? Or does the test need to be remeasured? What do you guys think? Thank you, Perfect Society. Thank you, Woody Brown. Thank you, Shawnee. I see you guys. Very good. Toxic. So, guys, the normal lithium range is zero point 0.6 to 1.2. Once that patient hits 1.4 or higher, this patient is in toxicity. And so you'll see signs and symptoms such as nausea, vomiting, abdominal pain, tinnitus, blurred vision, or abnormal vision. So if the patient's complaining of any of these and they're on lithium, the first thing you're going to do is check their lithium level because most likely they're going through lithium toxicity. Okay. And guys, that was a quick Kahoot, just 10 questions. But listen, everything that I went over with you guys, you need to know. I don't believe in fluff. If I'm talking about it, it's been seen on NCLEX over and over again. From the reports that have been given to me from students that have gone to take their boards, I haven't seen it with my own eyes yet, but I'm hoping to soon. We'll talk about that later. So make sure you guys review everything in this Kahoot. Make sure you know it very well for testing purposes. All right, guys, let's see how you guys did.